I'm Susie Roberti, and welcome, welcome, welcome to Let's Talk Tail Waggers. We're going to have a wonderful, wonderful show. Sometimes you cry, but most of the time you cry. And I cry as my fans know. Before we get started, I would like to say thank you to my camera person. Thank you, Frank. You know, BPTV is all volunteers, and you are more than welcome to come out and learn how to use a camera, do some editing, or maybe even come on a shoot with us. It's a wonderful little corner of the world. You will truly love it here. So now I am going to ask this lovely lady here. Her name is
Karen Litzinger.
And what do you do?
I have a business called Heal for Pet Loss, and I'm a pet loss counselor and author of a CD called Heal Your Heart, Coping with the Loss of a Pet.
Well, Karen is going to be my stepping host tonight. I get to sit down and listen and learn, which I love to do. So this is going to be Karen's show, and there you go.
Great. Thank you so much, Susie, for inviting us to be a part of Tail Waggers. I'm really thrilled to be here, and also want to thank Bethel Park Library, who generously offered to host this today as well. As a pet loss counselor, I always want to reach people as soon as possible because my interest is helping people realize it's normal and natural to grieve deeply. And I also like to honor the bond of animals throughout. And so that's why I'm really thrilled that this program, which is actually in recognition of National Pet Week by the American Medical Veterinary Association, that we have guest panelists to talk about a range of issues. The program is entitled Expert Advice for Owners of Aging or Ailing Pets, the final paw of the journey. And I know we don't like to think about that, but whether you have an older pet or whether you have an ailing pet of any age, I think you're going to find really good insights here to help you through whatever you're experiencing. So there are going to be 3 parts of the program, followed by question and answer. The first part will be about veterinary issues and keeping pets healthy and dealing with those aging issues. And then a section on pet loss counseling and grief, and then a section on dealing with the arrangements that can be helpful after your pet does die and that difficult period. So the panelists that we actually have, and I'll be calling people up individually, is our veterinary panelist is Dr. Terry Breneman from VCA Castle Shannon Animal Hospital. I'll be speaking about the pet loss section, and then for the third section we will be having Vera and Scott Beinhauer, who are both representing Beinhauer Family Funeral Homes and Peaceful Pastures Pet Cemetery. And I'll ask each of them if they can briefly introduce themselves as they come up and really sharing the educational material during their session. So I would like to ask Dr. Terry Breneman to come up and share perspectives on keeping your animals healthy and dealing with them as they age, and perhaps dealing with some of those difficult decisions such as euthanasia. Thank you for listening.
Hi, good evening. I'm Dr. Terry Breneman. I'm an associate small animal veterinarian at VCA Castle Shannon Animal Hospital. And I thought the easiest way to approach the issue of aging and ailing pets tonight would be to tell you a story about one of my own patients. She's one of my favorite patients, and I brought a picture of her. Her name is Lula. This is Lula. And she's adorable, isn't she? Lula came in. Her full name is Alula, like Bebop Alula. But we call her Lou. And Lou was under my care for most of her life. And she came to me in April of last year for a wellness exam. She was 12 years old. She's a female spayed terrier mix. And she presented, as she had been, every 6 months for her physical exam. And Lou had been coming to me every 6 months since the age of about 7 to get checked up. And that's a great idea for an older pet. They can't tell us what's wrong. And so checking their weight, listening to their heart, looking at their teeth, talking to the owner, and seeing what differences have occurred is of the utmost importance. It's the way we get the best information about our pets. And so she'd been coming every 6 months, and we really recommend that for older pets. And she'd been doing great. She was up to date on her vaccinations. Her protocols had changed a little bit as she'd gotten older, but we kept up with those. She was on her heartworm prevention. She was on flea and tick control through the summer. We would periodically clean her teeth and do dental cleanings through the years. She probably, all told, had about 3 dental cleanings through her life. And in general, she was one of those dogs who ran and played and never missed a meal. And she came to me in April of 2010, and her physical looked fantastic. And as a screening tool, we did blood work and x-rays on her. And we did this just as a part of senior wellness. It was a way to just get a sense of where Lula was. And she looked perfect. Her x-rays looked great, and her blood work looked good. Everything looked normal. And that was refreshing to her owner that at 12 years old, she seemed to have a clean bill of health. 20 days later, the owner reports that she returned home from work, and Lula had eaten her dinner and was chasing the cat on Thursday night and doing her normal shtick. And Friday morning, the owner woke up, and Lula had vomited twice during the night, and she wouldn't stand. She wouldn't get up. And when the owner tried to help her stand, she screamed in pain. And she presented to us in terrible pain, and so we gave her pain medication to get her more comfortable, and we repeated x-rays and we repeated blood work. And her blood work had changed just a little bit. She was just a little bit anemic, which frankly, in a 12-year-old, had she come to us that day and when we'd seen that, we would have thought, no big deal. She's 12, she probably has a low-grade anemia. But I knew 20 days earlier, she didn't have that at all. 20 days earlier, her blood work was fine. So something was wrong. And when we did her x-rays, the same abdominal x-rays we'd done 21 days before, we could see an obvious tumor where a kidney should have been, where a kidney was clearly visible 21 days before. Alula was in so much pain and needed such immediate care that we actually referred her to a referral hospital in the city. Castle Shannon Animal Hospital has 24-hour emergency and intensive care, but we are not a boarded specialty hospital. And at this point, if the owner wanted to aggressively pursue this, she needed to be in the hands of a boarded surgeon, because it looked like we were going to have to remove a lot of tissue surrounding that kidney, not just the kidney, but the tissue around it if we were going to remove whatever this tumor was. So we referred her. The owner rapidly had to make decisions whether to euthanize or pursue surgery. She elected that day to pursue surgery. And Lula stayed in their critical care department for about 4 days at the referral hospital. She had her kidney removed, the tissue around the kidney was removed, her spleen was removed, her liver was biopsied, and her stomach was actually pexing to her body wall so that it wouldn't pores or bloat, if any of you know what that condition is. She had a lot of surgery in a short amount of time, and was in the critical care department for about 4 days until she recovered enough to be able to come back to our intensive care unit. We did everything we could. We gave her medicine. We gave her IV fluids. We did plasma transfusions. We fought as hard as we could to save her life. After about 6 days, she was sent home to spend the night with her owner. She was not responding. She wasn't eating. And she was not doing well. And she didn't recover that night. She never really responded. The owner just wanted a chance to say goodbye. And a week later, the next day, the owner brought her to VCA Castle Shannon, and she had to be euthanized. She just never recovered from her surgery. I tell her story for 2 reasons. The first is that her case illustrates some of the major issues in dealing with this kind of scenario and dealing with an aging or ailing pet, because it can come like a thief in the night. The other reason I tell this story is because I know Lula very well, because she's mine. Lula was my pet. So she wasn't just my patient, she was my dog. And I faced every single issue that my owners have to face every day. And I think that if you go away with no other message, it's that the veterinarian that's helping you make your decisions has had to make these decisions too. And so just keep that in mind, because I think that it will establish a better dialogue when the time comes for your own pets. I'm going to keep her here as a reminder. But one of the major that I bring up is basic care. We like to see these animals frequently. Your veterinarian is going to ask to do blood work. They may ask to do x-rays, and these are for excellent reasons. If tests are normal, we never complain about normal results, but they certainly give us a baseline. And if they're not, there are diseases that we can treat. There may be diseases that we can cure, and there may be diseases that we can do nothing for, but we can manage their care until the end. Some of the other things that we can deal with in our aging and ailing pets are basic care issues like dental disease. Dental disease is a big issue in our animals, and it seems to owners crazy to spend that much money for clean teeth. On the contrary, we're trying to prevent a lot of disease states that are spread from dental disease, and we're trying to relieve a lot of pain. If you've ever walked around with a sore tooth, there's no pain quite like it. And so that's one of our big issues in aging pets. Arthritis pain is a big issue in our ailing pets. I start animals on pain medication, and owners come to me and say, they're like a different dog. And it happens so slowly that they didn't even realize it. And then you start to treat that pain, you get the inflammation under control, maybe get their weight under control, and all of a sudden, you have a dog who's acting 3 or 4 years younger again, and that's a big relief. And so these are all important things to remember. Age in and of itself is not a disease, but I think just like in human medicine, the healthier that we can keep those pets, the longer they'll live and the better quality of life that they'll have. And that's what I did with Lou. She was at the hospital every 6 months, just getting a checkup, just getting checked out, maybe getting her teeth cleaned, getting any appropriate vaccines. You know, she was on her heartworm prevention every month, and I was just like every other owner. I had to give it every month because if I took any time off, I would have forgotten. So, you know, that's an important message is that, you know, as pets age, you're going to see your veterinarian more often. You're going to spend more money at the veterinarian, and it's all for good reason because it helps us keep that bond with them and get more and more information at every visit. And it's kind of the best that we can do, short of her saying, you know what, something feels funny. I didn't know. I didn't know. And I had the x-rays and the blood work to prove it. She chased that cat the night before she was in care. So I think preventative care is one major lesson to be taken from her case. I think another factor to consider when you're dealing with an aging or ailing pet, and it's a factor that nobody really wants to talk about because it's so uncomfortable, but it's a harsh reality of where we are, is finances. In one day, I had to make a decision to spend $3,000 on a pet that I knew was very sick. She was at this referral hospital, and I had to call. I'm a veterinarian. I refer to them, and I had to give a credit card number before they take her to surgery. And rightly so. That's no different than any of our hospitals. But that's the reality of where we are. I just finished paying for her. She's been dead for a year. And that's something to be very honest about up front. I'd say one of the biggest differences between veterinarian and human medicine is that we got to be really creative. Our owners don't have health insurance for the most part, and so we deal with every level of financial capability. And if owners can be honest with us from the beginning about the situations they're in, what they can reasonably spend, what they can reasonably do, then we can try and work in that framework. And believe me, my creativity knows no end. I can always find a way. I do my job because I love animals, I want to help them, I want to relieve their suffering, and I can always find a way to make that happen, whether it's through hunting down the cheapest drug I can find, having it shipped from overseas, whether it's finding the cheapest blood work panel I can do. You know, we find a way, and sometimes it's not the best way or the ideal way, but we can find a way to help you and keep your animals comfortable as we can for as long as we can. I know that a lot of owners would not have pursued surgery that day, and I even had a veterinarian say to me after the fact, was it really worth the money? Probably not, huh? To me, at the time, it was worth it. It was worth it to know I did everything I could possibly have done to save her. But I think that had I not been able to do it, would that have been a failing on anyone's part? Not one bit. Because we would have humanely euthanized her and ended her suffering. And that was a perfectly viable option as well. But I think it's something to seriously consider when you're dealing with an aging and ailing pet. And be honest about it from the beginning. Be honest with yourself and with your doctor. And they can, you know, a good veterinarian is worth their weight in gold in terms of finding creative financial solutions for you. I think the third issue that comes into play when we're dealing with ailing and aging pets is what the owner can do. And I'm not talking about money at this moment. I'm talking about the time, the emotion that's invested in an aging animal. And if any of you have been through that before, it can be tremendous. It can be a tremendous investment. There can be a lot of medications. There can be a lot of driving back and forth. You know, anybody who's ever had a diabetic pet there's a great advertisement for pet insulin where the owner's chained to his cat. You know, the cat has a cuff on and the owner has a cuff on because they feel like they can never leave. And I think that that's something very much to consider. What can you reasonably do at home to manage that patient? And some owners have the capability to do that. They are, you know, I've had owners giving injectable medications at home, giving fluids under the skin at home. They have someone home with that pet all the time. And sometimes we can work that out. And sometimes we can't. And again, if you think honestly about what you can commit, then we can find the best solution. I had a perfect example recently of a cat with hyperthyroidism, which is a disease that's usually treated with medication. But the owner travels. She travels for work all the time, and she has 3 active boys at home, and I said, is this cat going to get medicine every day? Going to need medicine twice a day every day? Is it going to get it? And she said, absolutely not. And she said, no, she won't get it. And I said, that's okay, because there's other things that we can do. And there are other things, and they're a little bit different. They're not exactly standard of care. But we have other ways, and for that pet, that's the best way. For that family, that's the best way. And so I think we sometimes get tunnel vision, and we think about what we have to do for that pet. My pet needs it. Well, what does the family need? Because the pet's a part of that family. So what works for the family? And I think, again, if you honestly consider that, your veterinarian can work with you to find the best viable solution. And so I think that's another big issue to consider. What can you invest, other than finances, in this situation? You know, I think we even had an audience member that was concerned about getting home to her pet tonight. You know, we deal with this all the time. You know, how do we work around this? How do we deal with it? And I think if you honestly speak to your veterinarian about it, they can find solutions for you in terms of what works best. And again, it might not be the perfect solution, but what we're looking for are workable solutions for that owner, that pet, and that family. And so if owners consider that thoughtfully, what can I really do? Then I think it's something to consider. I have the blessing of working in the animal hospital. For 6 days, Alula never left a hospital. She was at a critical care facility. She was in my intensive care unit. Had I not worked there, would I have had that blessing? Absolutely not. I wouldn't have. So it would have forced my hand a lot sooner. And that's the reality of that situation. And that's okay. Again, that's not a failing on anybody's part. But I think that that's the reality of that situation. And I think the final issue that Lula's case brings to light, and I think it's the overriding issue, it's the reason we're all here, is what is that animal investing now? What's the cost to that animal? What's the cost of treatment? What's the cost of care? What's the cost of staying alive? And what's the cost of dying? And I think that's the hardest decision that we make. And when you're dealing with a sick or an elderly pet, what I tell owners to do is focus on broad quality of life issues. Is your pet eating or drinking? You know, and if they're not, that's problem number one. You know, animals who stop eating and drinking are animals who are letting go. Is your animal in a state of chronic illness? Are they having chronic vomiting or chronic diarrhea? Because that's a sign that they're in a state of discomfort. And we don't want them to live that way. If they're at a point where eating and drinking is becoming an act that results in illness, that's a problem. Is your pet able to get up and maintain its dignity and urinate and defecate and respond to you? Can they stand? Can they move? Can they do what they need to do? And I'm real clear with this about owners. If we're in a situation where they're having to get out diaper pads because that pet's laying in their own urine and they're having to worry about urine scald and issues like that, we're way past where we should be. And any good veterinarian will tell you that and will guide you in that. Are they in pain? And this is the number one question that I'm asked by owners. Bar none. Are they in pain? Because that's a deal breaker, right? That was a deal breaker for me. The day I took Lula to the referral hospital, I had 2 choices. She was either going to surgery or she was getting euthanized. She was screaming in pain, despite all the pain medications we'd given her. She couldn't live in the state that she was in. And that was it. It forced my hand. Now, she is a case that is an example of acute illness. I lost my other dog last year. She was in kidney failure and she had lymphoma. And she died in a very different way. She died over 6 months. And it was hard to assess that. You know, are they suffering? Are they in pain? We assume that they may be, because that's better than assuming that they're not and not treating it. And we can treat pain for as long as we can, but when we can't anymore, we have to let them go. And your veterinarian, again, will be the first person to help you decide that. In closing, you know, what I would say is that I had a professor in veterinary school say, you're going to have owners say, if it was your dog, what would you do? That's a terrible question. It's totally inappropriate. They have no business asking me. And I'd love to go back to him and say, well, you're a fool, because they ask it every day. And they have every right to ask. And a veterinarian will give you an honest answer. What would you do? How can we help? And that's what we're there for. And we will guide you through that decision and make honest assessments as to where that animal is in their disease state, where they are in terms of their comfort level, and when it's time to let them go and say goodbye. And that's hard. It's hard for us. It's hard for us as veterinarians, and it's hard for us as owners. And I remember Lou every time I do it. But they will help you make that decision, and I hope that some of the points I brought up here tonight will help you make those decisions as pet owners when it comes time for your pet. Thank you.
Thank you so much, Dr. Drummond. And thank you for donating your time from BC Russell Shannon Animal Hospital, because I know that you're very busy. Oh, wow. Where to start? I guess on the pet loss end, I like to start with the bond and ask, how many people here refer to themselves as mom or dad to their special ones, right? They are our families. There was actually a survey from the American Animal Hospital Association that showed that 83% of us refer to our animals in that way. And so I like to share that because that's the reason the grief is so deep, because they are our family members. And actually, sometimes we grieve even more deeply for our animal companions than even family. I won't ask for show of hands here, but that can be partly because of the unconditional love that they give. There's no history, there's no baggage, and they're constantly with us. They're like our children, even when they are 19, and they are our children. And that's the main message that I want to give, is that it's normal and natural to grieve deeply. Sometimes it doesn't feel that way because others around you might not get it or understand. And you want to surround yourself with supportive people. It's also helpful, I think, to let people know that you've gone through a loss. I typically email friends and family. And those messages back or those sympathy cards are very meaningful to me. And the ones who don't email back or don't get, that's fine. So now I know where to get my support from. Pet loss is also, in a way, come out of the closet. And some of that is because of the internet. And I don't know if people here, you know, some people use the computer, some people don't, but there are indeed some wonderful national internet pet loss support groups. I actually did my training through the Association for Pet Loss and Bereavement that has chat rooms 5 days a week supervised by a psychologist, and every other week a chat room on the difficult decision of euthanasia. So getting support is one of the key items. Back up to the emotions that you feel. Realize, just like it's any loss, you can feel a range of emotions, and there are standard sort of, sometimes people call them stages, but they're not really, but different experiences you might have through grief. And that could be shock, and that might be at the death, or it might be at the diagnosis of a terminal illness where you go blank and you can't even hear it. That's shock. Or disbelief, where you can't believe that this is really happening to you. And of course there can be anger, and sometimes that anger is at the vet when you feel like you want them to fix it, and you might nitpick every little thing. But remember, as we heard today, you know, they're animal lovers and doing the best they can. the anger might be at yourself. And that gets into the should-haves and could-haves of guilt. So besides the emotions you might feel, you get thoughts that are negative. I had that experience when my dog Pepper, who was 15, who was actually the inspiration of the CD that I produced when I came home with this cremains. I wanted to help other people as a licensed professional counselor. But it was that experience of decline where I was in the agony that so many pet owners go through of, is it too soon? Did I wait too long? And I had people think both sides of that, I think. And so I would share that at times, euthanasia is a courageous, humane decision and gift that we give to our animals, and a responsibility that we may take on by having an animal. And to realize that there's a lot of gray area, as we heard from Dr. Brenneman, and different situations. And you don't want to beat yourself up to say, oh no, I didn't have the financial means to do this. You know, you want to remember, I did the best that I could and gave care to my animal throughout their lifetime. So it's those positive thoughts that can make your emotions just, you know, get stuck in the grip of guilt, or to treat yourself as kindly as your animal would treat you and want to see you treat yourself. So another point is really taking care of yourself emotionally as well as physically. So thinking about these things in advance is significant, because one way that you might take care of yourself is to perhaps call off work the next day. Now, we give ourselves bereavement days for humans. That is completely acceptable and appropriate for our animal family too. You also want to take care of yourself physically. Eat well, exercise, you know, just otherwise it can be a downward spiral. You don't want to, you might drown in your chocolate for a little while, but you don't want to be doing things like inappropriately, you know, drowning yourself in alcohol, for example. So taking care of yourself spiritually is another piece. Everyone has different traditions, whether it's a spiritual tradition or a philosophical view. But whatever it is, you know, honor that and see that as a means for healing. Realize there is no right or wrong time frame or right or wrong way to grieve. That's a very important message too, because some people express themselves emotionally and intensely, and some people might find healing from building a picture frame for their animal or a memorial stone and not express emotions as much. It's okay. It's just your way, and you don't want anyone around you to tell you what's right or what's wrong. Related to that is finding perhaps some physical ways to memorialize your animal, because that can be part of the healing process too. For myself, you know, I had actually collected all these pictures of Pepper, because, you know, I would, back when they weren't digital cameras, you'd get two shots, you know, and so I always got double, duplicate prints, and so I just stashed them away. And at some point I thought, well, we'll make a little Pepper picture album. And so, you know, when Pepper died, I had the envelope labeled Pepper's Progression, you know, and so part of the healing for me was creating that photo album. Some people can't even look at pictures of their animals soon after. And some people want that and need that. Some people need to put their things away and their effects, like the collar, and some people like to keep that. I still have my water bowl of my Tika, who died a month and a half ago. And I put a lot of things away, but for some reason I just left that out, and I thought, let's just let that evaporate. And that was part of my ritual, looking at her water bowl and thinking of how she's left me. And everyone is something different, and I don't know what it will be, for me from time to time, and what it would be for you. I had a memorial service in my home for my dog Pepper, because I've done that as part of my business for other people, and so that's part of what I felt comfortable doing. I have special music, a candle, all of those things, and that really was my motivation that inspired me, as I mentioned, to do the CD, because I was traveling back and thinking I wanted to help other people in the way that I knew how to take care of myself. It didn't make it any easier. I was still, in pain with the euthanasia decision and in pain later. And your experience will be unique to you. There's my message I probably would mostly leave again. It's normal and natural to grieve deeply. There's no right or wrong time frame, no right or wrong way to grieve. Just let yourself feel and experience and trust it. And it's moving through it. It's moving through it. If you hold it in, the healing can get stuck. So, and there are resources to help you, whether it's online, or a book, or a CD, or a chat room, or just your friend or your spouse would find some type of support that works for you. And as a licensed professional counselor, I always like to say, of course, that if you are feeling stuck and not able to move forward in your activities of daily living, I mean, you can be under the covers for a couple days, maybe a week, I don't know how long, maybe longer if you're able to do that and you don't have to get up for work. But if it's too long, and you know what that is, or you might not know what that is, someone might tell you what that is, and they might suggest, maybe you need a little bit of assistance. And at some level, whether it is a grief counselor or a therapist, know to reach out for that. The last thing that I'd like to share, and a question that often comes up is, when will I know whether to get another pet or not? When is a good time? And again, with so many things in life, there's no easy answer to that. There's no right or wrong time. You need to trust yourself. Now, traditionally, I would say in the pet loss literature, there is consensus to watch, not to try to go fast to get a replacement pet. And I'm using the word replacement pet specifically because I have seen people who've gotten an animal quite soon after the animal died, a week, and were fine. And sometimes, and I'm learning that works for some people, even though traditionally people say to wait longer. The most important thing is that you have expressed your grief, that you have moved through in some healing, and that you're not looking for an exact replacement. Now, I have had two clients, one who purchased the CD, and she got an animal very soon, and she was thrilled, and it worked for her. And when Tika died, she emailed me and said, Karen, go get another little one, get someone to love. And that could work. I wasn't ready yet, but that could work. And then I had another client who was looking for the replacement pet and searching on the internet across the world, even to Africa, for this exact dog that looked like hers. And she said to me, I just couldn't believe he was gone, and I was looking for him. So there was that disbelief and shock piece that was going on. And she found the dog. She was getting it the night before. She said to her husband she didn't think this was right. But her husband said, you've been looking 8 hours a day for a week for the animal. You found the animal. Let's get it. And she got it, and it was a mistake. She couldn't bond with it. She couldn't look at it. Her husband loved it. She read a chapter of my book, and she had had a conversation beforehand with a breeder who said they would take it back and find it a good home. And she did do that because she needed to heal from a trauma because she witnessed
her animal being killed by another animal. It was trauma that needed time to heal. So in closing, there's no right or wrong time to know when to get an animal. You need to listen to your heart. There's no right or wrong time frame. Also in grieving, it's experiencing it in right way. So I want to conclude my section, and we'll be taking questions at the end. And I would like to introduce our next section. And we've got Barry Bear and Scott Beinhauer. You want to come on forward from Beinhauer Family Funeral Homes and Peaceful Pastures Pet Cemetery. And they're going to give you a little overview of things to be thinking about. Thank you.
We're going to double team this.
And we'll do our best to assist each other through our part of the program.
You know, really, after listening to our first two speakers, I realize even more now that when we get the call your pet has died and you need help deciding what to do with your pet, you've been through an awful lot. And I think the Beinhauer family realized that many, many years ago because they started thinking about a pet cemetery many, many years ago. And it was in 1999 that they really said, we need to do something. All we're doing is what we've been doing for our families, for our families at Beinhauer for many years, and that's helping people cope with the funeral and the options that they might have. So in 1999, the Beinhauer family, they did buy some acreage out in Washington County. It's now Woodruff Memorial Park, and there's a section out there known as Peaceful Pastures Pet Cemetery. And now we're actually offering the options that nobody really had. I know when I was young, there was very little options when some of my pets died. It was either, if it was a fish, you flushed it down the commode. If it was a dog or cat, hopefully you could bury it in the backyard. And that still exists today. I take a lot of calls from the pet cemetery, and a lot of times people say, what can I do? Okay, and you can still bury pets in the backyard. Most people aren't doing that anymore. But what we did at Peaceful Pastures Pet Cemetery is we developed not only the cemetery, but we also developed a funeral home for pets. So now we can provide for our pets the same that we do for our families, for our mothers, our fathers, our brothers, our sisters. We offer the same cremation options that we would for a human being. We offer the same in-ground burials that we would do for a human being. In the future, I would imagine, and correct me if it hasn't been talked about, we are planning a section where people with their pets can be buried together. Okay, because the requests are there. People are already doing it with cremation. People will have in their prearranged funerals, a lot of people will prearrange their funerals and they'll say, we bury, I have the urn of my dog in the bedroom. Can that be placed in my casket? Yes is the answer. So we have been doing this all along. Now the requests are, can we be buried next to our pet? Okay. But the options are there. Cremation is still the #1 choice, and I think that's because the pet owner, or the mother, or the father, still wants to hold on to that pet.
Take possession.
So cremation is still one of the big options, but earth burial is becoming a very, very big option for many people who have larger pets, have additional pets, okay, and they'll come out to the cemetery, believe me, they'll come out to the cemetery to visit the grave of a pet that they have buried there, and they'll bring their other pets with them. And we allow that. We're totally open to that. I think we're all pet lovers.
I think Karen had mentioned,
Pet lovers.
I believe I heard you mention during your part of the program, Karen, that a lot of families care so deeply about their pets, and sometimes they care more about their pets than they would their own family member. And you know, we often hear that same comment from the families that we care for. And you know, I believe that the way that we approach any family that we care for, whether it be a human family or a pet family, is we care, we approach them and we handle them and care for them with the same professionalism and compassion that we would as if they had lost their brother or their mother, because losing a pet can be very emotional and can be very devastating for some families depending upon circumstances and situations. So So that's how we handle it. And most of our staff is also trained to respond to the needs of the family as well because of our relationship with our pet cemetery. We often get calls at our funeral homes from families, and they have questions about their pets and how we can assist and how we can be helpful. But it's not just about the services that we provide and about our cemetery. I mean, there are several cemeteries within, the Pittsburgh area, and maybe some in your own communities that will be able to provide very similar options to yourself as well. And I would also consider, your veterinarian as a wonderful resource in regards to, what can I do? What should I do should something happen, to my beloved companion? So again, it's about providing care and compassion and professionalism regardless of the situation.
Let me just further talk a little bit about the options that you do have, okay, as far as, say, for cremation. And again, there's costs involved. And again, we're very compassionate. We can work within people's budgets. Our costs are very low. We try to keep them low, even though we operate our business as a funeral home, which means 24 hours a day, 7 days a week. We try to respond to a family's needs. Okay, with cremation, there's 3 options. You can have, choose what they call common cremation. Common cremation is one where you want your pet to be handled professionally. You want your pet to be cremated in a very professional way and caring way. Yet that particular pet will be cremated with other pets. And the only disadvantage of that is you cannot take possession of the dog's or cat's cremated remains. Then we have what we call an individual cremation, which is the one most of our families choose. An individual cremation gives you the opportunity that when you cremate your pet is cremated in its individual container, its individual contained area, so that when the cremation process is over, we can return those cremated remains to you, and you have the assurance that it is your pet's cremated remains. Then we have what we call private cremation. Private cremation literally involves the family. We have our own crematory. We have a room that's right next to the crematory where the family can actually go in. You can actually, if you prefer, see your pet being placed into the crematory. You can be there during the process, and we can return the cremated remains to you later that day. It takes them a while, obviously, to process and so forth. So there's 3 options with cremation. They all vary in cost. What affects cost? The size of your pet. Unfortunately, the bigger the animal, will be a little bit more costly. But in reality, the cost overall is very, very low. We try to keep it that way. We also will remove or transfer your pet from either the veterinarian's office, if it had died there, we would work with the veterinarian to pick your pet up at the veterinarian's office, to bring your pet to the cemetery. If the pet would die at home, often we get calls on weekends. Pet was hit by a car. Okay, that's a frantic family. They have a dog now that just hit by a car in their front yard. We'll be there, and we go out, and we don't just take your pet and forget it. We comfort you. We walk you through the process, allow you to make some decisions as to what you're going to do. We also, prior to the cremation, offer our families an opportunity to say their goodbyes. The same as if it was your mother, your father, your husband, or whatever. You can come to our cemetery, into our funeral home area. We have a special area where you can gather as a family and actually view your pet prior to the cremation. We also do that prior to the burial. Some people want to be there for the burial. We actually groom your pet. Okay, you're not, if your dog is hit by a car, your cat is hit by a car, something. Part of our responsibility is the same as if we were serving your family at the funeral. We're going to prepare your pet so that if you want to bring your child in or grandson or someone, it's going to be under very, very favorable conditions all the time.
We've tried to approach those same service options as we would approach any family who has lost a loved one. We felt the need, we felt it was very important. And our community had told us, listen, we need some additional options. We have some questions, what else can you do for us to help us deal through the process? So that's why we offer, those same options. And we also have the advantage of, we've got a cremation center, state-of-the-art cremation center at our pet cemetery with its own crematory. So we can make available the cremated pet back to the family in a very timely fashion, because we know for some families that's extremely important.
And likewise, then, we also offer burials for our pets. Okay, we do have a beautiful cemetery. We have caskets. We also have burial shells, which again can keep the cost down. Families can provide their own container or their own casket. A lot of people say, well, could we bury our pet in this or that? As long as it meets some of our rules and regulations, and we try to be very, very lenient as to what our families can do, because we know what it means to. You can memorialize the grave if you bury your pet. You can buy markers. And you can buy them either from our cemetery, or you can buy them from other winery companies. We work well with everybody on all of those situations. Likewise, if you're burying a pet, again, size becomes important. When we go out to the cemetery to buy grave spaces for us, the graves are mostly all the same size. But for the sake of how we laid our cemetery out, we had to think about the different sizes of our pets. So we have graves in our pet cemetery that can accommodate what I call barnyard animals: horses, cows. Okay, we have graves that can accommodate large dogs, medium-sized dogs and cats, and very small ones. So depending again on the size of your pet, will play a factor in the cost. And again, we try to keep that as low as we possibly can and still operate at a 24-hour day, 7-day-a-week operation. A lot of folks will prearrange their burial cremation service. They are working with their veterinarian. They do have decisions to make. Are we going to do the surgery? Are we going to opt to do this? A lot of times when a family goes home, they think about, boy, we better call and find out what we're going to do. And they will call us. And they'll put us on high alert that they are thinking about having their pet put to sleep. Okay, and they can prearrange this. Okay, a lot of families who have multiple pets, when they come out and their first pet dies, they'll do the same thing as we do as humans. They'll purchase a grave for the first pet that died, and they'll reserve by buying the spaces next to those other pets so they can have all their pets together. We have one family out there, I won't mention the name, but he's a breeder, poodles. Okay, and he loves his dogs. He almost doesn't want to sell them. He breeds them and he sells them. But part of his arrangement with those families who buy his pets are that they be buried in that plot. And he provides them with the markers. He has a marker right in the center of their plot. And then every pet that dies that maybe you're familiar with it, he literally puts another little marker at his expense if people bring that dog back to you. So, I mean, we offer all those options. We have llamas buried in our cemetery. We have buffalo pigs. We have horses. Cows. Some reptiles.
Just about.
There's some reptiles. A lot. We have one lady locally who literally takes care of injured birds. And when one of them pass away, we handle that for her. So there's a lot of people, a lot of heritage already that people have found that they now have an option, which we never did. I remember when my first goldfish died, it was either down the commode, or in my mother's copper. Everybody smoked cigarette back in the 50s. It was either down the commode or put my goldfish in a little copper cigarette box from my mother's. You knew what I did. I took all her cigarettes out and put George in that box. Took them outside and buried them. My mother came home from work, all the cigarettes on the table. First thing she said, "Where is my cigarette box?" And here I am, like 10, 12 years old, and I'm like, "She's not going to like this." Well, that same day, I buried my goldfish. I disinterred him. I dug him up. He ended up going into a mayonnaise jar. But he wasn't going down the commode. He was in a mayonnaise jar. 50 years later, folks, I'm still burying fish and other animals.
One other thing that we're extremely proud of is we also make available we have an annual memorial service and a blessing of the pets. So we encourage those families who have lost a pet to attend the service. And if you've got a new pet, a new companion, we ask that you bring the companion out, and we usually work with the clergy person, and they will bless your pet. And so that's something that we've been doing for, I don't know, very many years. Yeah, so Ms. Gary was involved. Yeah, so it's something that's extremely important to us. And I think in closing, what we'll mention is that everybody's needs are a little bit different. And so I think that it's important that you decide as a family what's best for yourself. Use your veterinarian as a wonderful referral, and if there's anything that your local community can provide for you, I would encourage you to call your service provider and see what options they might be able to be helpful with. So thank you for your time.
Thank you. Actually, we can start this slide there. And Mary can join us. We're going to open this up for questions. So please just, scoot in, and then whoever is, has the question can get closer to the microphone so that that can be covered well for tail waggers. Any questions at all?
I have a question. The irony is I had an 84-pound lab whose weight I watched all the time. Now she weighs a little over 70 pounds. And she does eat, but she is bored by any routine that I established that will get her feet. So I don't know if you have any suggestions to keep them interested in food. And I am concerned. She always had the dry food. Her teeth were wonderful until this last year when I'm introducing more soft food.
Did you intentionally mean to get her weight down to 70
At
pounds?
first I did, but now no.
Okay.
Yeah, she lost probably about maybe 9 or 10 pounds early on through a drinking diet.
Okay.
I always watched her weight, but now she's getting too low.
Okay. And how old is she?
She's headed for 13.
13. I think she's a wonderful example of a pet that needs to go to the vet. And the reason is that I think without a lot of really, really hard work for a pet to lose 14 pounds.
Well, that's over several years and we did try to start. But I can tell she's lost muscle.
Yeah, she's
She
lost
has
muscle
those
mass.
problems.
The first thing I would do, honestly, is check her with her veterinarian. I'd get a set of wellness work done on her and just make sure there's not an underlying medical issue. Certainly, there are a lot of medical issues we see in our aging pets that can affect their appetite or affect their metabolism. So make sure that there's not a medical problem first. Because I think when you go down that road of trying to tempt them, first canned food, then boiled chicken and rice, then peanut butter, then cheese, pretty soon you run into one of two things. You either run into an animal who's getting sick and you're missing it because you're feeding them a different food every night and you're not realizing that they're not eating because they're not eating. Or you have a pet that's training you really, really well. And they start to think, well, if I wait her out, she'll get me what I want. Fried chicken. And, my rule of thumb is that I've never known a healthy dog to starve themselves to death. Never known a cat would, but the dog wouldn't. And so eventually a dog will eat. And they'll eat to maintain their calorie requirements and they'll maintain a healthy body condition. So the first thing I would do with your pet is make sure there's not a medical issue. Have your vet check some blood work, do a good physical exam, start there, and then start to deal with dietary issues. Because this may not be a dietary issue, this may be a medical or health issue, and it may just be worth getting to the bottom of it. It may be an easy fix that way, and something may just need to be addressed. But I would check that first. Because what you don't want to do is go down the road where you're being passively trained. Because that can be a hard road. I think especially when we slip down that slope from dog food into people food, then it's really hard to find the slope.
Her basis is the dog food. And I can make a piece of chicken like this big last for 3 days.
Good, to tell her. And that's fine. But
But it ends up being soft food because I put a little bit of
water into it. And that's okay at her age if it keeps her eating. But I would have the same routine every day, because otherwise she'll start to train you. And what you need to know is that every day I'm making this, and she's eating it each day. And if the days come where she's not, you need to know that, because the sooner you can find that out, the faster you can address it as a problem. Does that make sense?
So another question, go ahead.
Yeah, I have 2 questions. Does anybody know of any veterinarians that make house calls that do come to the house anymore?
Yeah, sure.
I don't know if I can remember them all off.
I mean, there's Dr. Barbara Smith, who makes house calls.
Wait, Smith, because I went online and I didn't have any luck because everybody I called said, oh, they used to, but they don't anymore. So-
Yes, Dr. Barbara Smith still does. Barbara Smith is her name. And there's also,
Nancy Ruffing.
Nancy Ruffing owns a pet hospice service. It's called Gentle Journeys.
Gentle Journeys.
Yes,
What's
and
the last
so,
Ruffing, Ruffing.
yes, and she does end-of-life care. So typically that comes from, with a referral from your regular veterinarian. And there's also a mobile practice called Vet to Pet that will come out.
And then the other one was just very, you said, because that's one of the questions I was going to ask you, was I wasn't sure about having my pet cremated, so I said, well, if I have him cremated, then I want to be cremated because I want us to stay together. And you said you were going to have a section where you can be buried beside each other. How many were in the future is that?
I think maybe Scott probably has a little more insight on the plans. I know we've talked about that in meetings about having
So
a
there's
section.
no way of doing that?
As of right now, we don't have
I mean, what
that.
if I pre-purchased something? Like, it's not there yet, but you know what I mean?
You could pre-purchase those grave spaces, yes.
Yeah, like
We would
one
call
for
it,
each.
yeah, it would
One for
be considered an undeveloped area. And then once we would develop the
Because, yeah,
area.
hopefully, you know, we'll both be around for a little while longer.
Yeah. Now, cremation is the other option. If you're going to have your pet cremated and you cremated, then the grave space may not even be an issue because you could be looking at having your pet's ashes and your ashes placed in the same
I'm
urn.
still trying to decide on the
And then
cremation for either one of us, you know?
Yeah, well, that's the first thing you have to answer. You have to decide, you know. And the easiest way to do that is say, if I had to make the decision right now, or if I was dying right now, what would I do? That's the only
Because
way
I
to
keep
do it.
reading and going to the Bible and all this stuff, and I seem to be in sort of a,
But in order to bring yourself to that point, I deal with people who make prearrangements all the time, and they don't know what they want. And I finally say to them, you're going to die within the next hour or so, and you can't say, I don't know. You have to tell me now. So that's how you base it. But you can prearrange. We're very adjustable. If you come out and purchase a grave, and on down the road you decide to be cremated, we would take the full purchase price of that grave and credit it to whatever else you're doing.
okay.
It's not like you're going to buy the grave.
I guess I'd have to say, really, no, I really like both of us to be buried in, you know, casket.
Right.
The two, you can be buried in the same grave. I mean, if you're talking about like an adult-sized grave,
Yeah.
because as Barry had mentioned earlier, and I don't know if you alluded to this or not, Karen, but you do have a great deal of families who, you know, they wish they lose a pet, the pet's cremated, and their wishes are to have their pet buried with them. And we have families often who bring in the urn of their pet, and it's placed right inside the casket with them. Or, you know, you can also place the cremated body of the pet right inside the same urn, sometimes in the same urn as the individual. So I think it just depends upon your family's needs. Everybody's needs are a little bit different. But, you know, the need is growing, and as more and more people see value in that, it's something that we're certainly going to get a little more active with.
We offer as a free service what we call pre-planning advice, where you literally could come into our office and we could come to your home and we could put all the options out on the table for you and then leave that with you, and then you can think about it and you can call us back and say, this is what I want to do. And that's the best way to do it. When you're ready, call us. And we would more than, and there's no charge for that.
We have time for one more question. So, question for you.
I don't know what the policy of our veterinarian is. I work with people homes as coaches. If they allow me to be present, it ends up that I am going to sleep. If they would allow me to be present, I would love to be there, but I don't want to see him struggle at all. Aren't there, is it not always guaranteed that the pet will go quietly?
That's a great question, because that's one of the,
Can you repeat the question just so that?
sure. Her concern is over euthanasia protocols and whether that's a peaceful process or whether there's any pain or struggle involved. And that's one of the most common questions I have from others, because that's their biggest fear. That's my biggest fear. I can't imagine anything worse. It's one of the most important things that I do is provide a peaceful and humane euthanasia. And I think one of the important things to do is express that fear to your veterinarian. That's not an unfounded fear. I think that's a very legitimate fear, and they can help you with that. I always talk my owners through a euthanasia procedure. I know at Castle Shannon, we always put an IV catheter in the pet's leg so that we're not struggling for a vein, we're not having to restrain them, we have IV access. The first thing I do is give them a sedative. I'll be honest, the last thing that pet is aware of is, if the owner wants to be present, is that owner talking to them and petting them as they're sedated. I literally give them propofol, which is the drug that Michael Jackson was on. It's a powerful anesthetic induction agent. It induces general anesthesia, and that's what we use to sedate them. And that's the last thing that they're aware of. And then once they're completely sedated, we give them an overdose of anesthesia. And so they literally just pass away. And not with the sedatives that we use. And I would express that to your veterinarian, because I think that they can ensure that that process is as peaceful as possible. Now, sometimes their breathing may change. Sometimes when they're sedated, they may move a little bit. And it's just an anesthetic reaction to the drug. Just like when we're sedated, sometimes it feels a little funny. So sometimes they may move a little bit, but for the most part, we work very hard to ensure that it's a peaceful and calm procedure. Because I'll be really honest, the most important minutes I spend with a pet owner, bar none, are the moments when I don't have a patient anymore. It's the moments when that patient leaves us and I'm there with that owner. And so my job is to keep that as calm and as peaceful and as atraumatic as I can. And so we work really hard to make that happen. And I've had owners express that fear. I would express that fear to your veterinarian, and they will make every effort, I promise you, to make sure that that doesn't happen. I have some owners who stay just for sedation, and then they like to step back. If at any point an owner feels like they don't want to be present any longer, they just tell me. That animal is never alone. I am always there to the end. And if that owner needs to say their goodbye awake and leave, and remember their pet awake, that's okay, because I'll be there to help them through. I'll be with that owner until the very end. And any good veterinarian will do that, and I believe that. And so we work very hard to make sure that that doesn't happen. And I think if you express those fears to your veterinarian, they will do the same.
Thank you. And on behalf of Who from Pet Loss, I want to thank all of you donating your time from ECA, Castle Shannon, and My Tower Funeral Home, and Susie, and Tailwaggers.
Everybody staying together.
So much.
These shows are the hardest for me. And I knew I was going to cry, but you are wonderful, people to come up and volunteer your time. And Barbara, I'm head first this time. Thank you for opening your heart, because it means I know where my family hurts.
Oh, yeah. It's hard to get through that.
You never really do. And Karen, thank you for being you. Thank you for all the information that you shared with everyone this evening. It's going to make it a lot easier for you. And when you go home, please share this information. And if it's a turtle that someone loses, don't just say it's a turtle, or a bunny rabbit, because it meant something to that person. And Spot and Bears, the one thing I enjoy so much about Peaceful Pasture is that you can go out there in your sad times or happy times and just sit there very quietly with your pet, and nobody's there, and you can look around and see all the grass and trees. It's such a beautiful, beautiful place. And truly, that means a lot to people. But if you're sad, it calms you down. just being out in the fresh air and everything. It means a lot. So I want to thank all of you for coming to the Tailwaggers. And once again, thank you, thank you, thank you, thank you. And like always, remember your humane societies. If you have any sheets, towels that are too old or used to give to the homeless, pack them up and send them to one of your humane societies. They'll really appreciate that for operations and putting those in cages. If you have a little bit of money, sending's getting really hard for them these days. And there is nothing more in the world that I can say except I love you. And thank you from all the Tailwaggers.
In 1776, the Reverend John McMillan established two divisions of his congregation, the Eastern Division being called Lebanon and the Western Division being called Bethel. Bethel was incorporated in 1886 as Bethel Township, rich in agricultural and farmland, and by the start of the 20th century, Bethel grew as a result of advances in railroads and transportation. Pittsburgh Terminal Coal Company built Bethel's first coal mine in Mullingar in 1902. And in 1921, a model mining housing community was built in Coverdale. Pittsburgh Railway's trolley system provided transportation through the 1920s and 30s, and currently Port Authority of Allegheny County's light rail system that runs through Bethel Park and the South Hills has become a major mode of transportation. In 1949, due to enormous growth, Bethel Township was named Bethel Borough as a borough form of government, and by the 1970s had grown with residential development and commercial businesses to become a home rule municipality known as Bethel Park. With the 2010 census reporting the population as 32,313 residents, the municipality of Bethel Park remains one of the largest populated suburbs in the South Hills. Now therefore be it resolved that I, Clifford Morton, by virtue of the authority vested in me as the mayor of Bethel Park, and on behalf of the Bethel Park Municipal Council, do hereby proclaim this day, June 7, 2011, to be known as the 125th birthday celebration of the municipality of Bethel Park, in honor of all citizens and elected officials, both past and present.
Hi, my name is Sarah.
And I'm Denise, and we're here at the Western Pennsylvania Humane Society.
We are here to tell you about our Girl Scout Gold Award project.
As you can see, these animals are very lovable, but there's a problem here at the Humane Society.
They do not have enough wet food to give to their animals.
And that's where you guys come in.
We are asking for your help through a generous donation to the Western Pennsylvania Humane Society. At this time, we have collected over 1,000 cans and donated them to the Humane Society, but they still need more. These animals need their food so they can continue to have healthy, full lives before they are adopted out to a loving home.
Another way you can help out is by adopting an animal from the shelter.
Thank you for your time and attention, and I hope that you have the consideration to remember the animals at the Western Pennsylvania Humane Society.
I am Joan Rivers with an important announcement. Getting old is horrible, okay? Horrible.
You're not old. I mean, you're older, but you're not old.
You want to say old?
Oh, God.
Yes. Grow up, for goodness sakes. The last man to hit on me was an undertaker. I know where
I don't want to talk about
Well,
this,
you're going to
Mom.
have to talk about it. It's the future. It's coming right at us. And I'm not worried about dying. It's getting there. I mean, heaven is going to be fabulous. It's going to be a giant shopping mall, and there's going to be 20% off on everything, except for me, 44.
You know, you're doing jokes, and I'm just not ready.
Well, you have to be ready. You have to listen to me. Look, there are things to discuss. They're going to be my needs. They're going to be my wants.
You know, Mom, I don't want to hear this. I just don't want to hear this. La, la, la,
Don't give me la, 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 la,
I
la.
don't. I can't. I can't do
Talk
this.
to your family about aging, even
No.
if they're not ready to listen. Come on, listen to me. Listen to me.
For the first time?
Yes, for the first time.
No matter who you are, it's not easy talking about aging. For help, go to voa.org/talk. A message from Volunteers of America.
Kathy, who's lived most everywhere, from Zanzibar to Berkeley Square. But Patty's only seen the sights a girl can see from Brooklyn Heights. What a crazy pair.
Kath, have you heard from Patty and Richard yet?
Yes. Patty was going to stop and pick up a pie, and Richard was going to file for Medicare.
Filing for Medicare? We won't eat till midnight tomorrow.
Richard's filing for Medicare online at socialsecurity.gov. It takes less than 10 minutes.
10 minutes? I had to go to the office and wait.
Online.
What about the paperwork?
Online.
But Richard's still working.
Line. Hey.
You made it.
No problemo, Papo. I got the pie.
And I got my Medicare.
And I've got the turkey.
Did you get that online too?
Hey, you ready? Of course I am. What are you waiting for? I was waiting for you. So we're gonna continue the hubby thing real quick.
Okay, places everyone. In a minute! Do I have to do everything myself?
You can't do it all by yourself.
I have to say that...
Sure I can.
No, he can't. And neither can I. So why don't you come on down to BPTV and help us make some of the great community programs you see on this station every day.
Yeah.
I mean, we can help you make your TV show ideas a reality.
It's pretty awesome.
So come on down. I mean, I am pretty good. But I'm sure I could use your help.
Hello, this is Nancy Meyer, and I'm a resident of Bethel Park. Did you know that our wonderful community is 125 years old this year? Well, it is, and we're searching for that person who has lived here longer than anyone else. We have lots of activities going on over the next few months, and we'd like to honor that special person who has lived here continuously for the longest period of time. Just come up to the library and look for the flowered box on the circulation desk. Give us your name, the date you moved here, and your contact information. You can nominate yourself or nominate someone that you know. I'll be calling you to let you know how we will honor you as our very special resident. And please watch for information about all the other special activities that are going to be coming up in our community over the next few months to celebrate our 125th anniversary.
Once you figure out how to speak your kids' language, well, you don't really have to say much at all. From the Church of Jesus Christ of Latter-day Saints.